Hello, everyone. Okay, I hope everyone is doing good. All right, just as a second. All right, I hope everybody's doing good. Everybody's doing all right. So I figured I should help type because there are some things I'll need to type out for you to see. Some words that I haven't probably are not familiar with. Okay, so that's why I'm sharing my screen today. So I've dropped the YouTube link on the group. So anybody who's watching on YouTube, in case there's any issue, please quickly switch to the group. All right, quickly switch to the group. So the link is the YouTube link is on the group. The link to the group is also on YouTube. So it's like there are two ways, whichever one works, right? But on YouTube, I'm sharing my screen because I just want to be able to type out some of the words I'm going to say for everyone to see. Um, let's see, new slide. Oh, there's a picture I want to drop so that we can all. Okay. All right. So the topic of our conversation today is protecting the heart from the effects of weight, hypertension, and obesity. And the most important thing I'm going to be highlighting today is what are the 5 signs, all right, the 5 signs that you need to protect your heart from chronic illnesses, the most common being hypertension, obesity, and diabetes. What are the signs that the heart is under pressure? All right, what are those signs? What are the signs to look out for? Signs that tell you that whether it's your weight, whether it's your blood pressure, whether it's your um, blood sugar. Oh, my bad. This should have been weight, hypertension, and diabetes. All right, so obesity, hypertension, and diabetes. Let me quickly adjust this. So, so yeah, right. So, what are the signs that you need to take note of that you need to now start taking extra steps to protect your heart, which would most likely include seeing your doctor, right? And I'll tell you 1 or 2 tests that you might need to run if you have any of these signs. Okay. Um, so I think we can just jump into it. For those of you who don't know me, especially on YouTube, I'm Dr. Max. Um, so I've just come on this channel to help educate people on their health. And feel free to ask me any other question regarding weight loss, regarding your weight loss journey, your blood pressure control, your blood sugar, whatever it is. Feel free to drop your questions on the YouTube channel, or if you're on the group, feel free to um, join the conversation if you're on the group too. All right, that's the WhatsApp group. Now, the first sign, all right, the first sign that you need to take um, cognizance of regarding your heart, and let me be clear. So I'll try to remember something else I was going to say. So if you notice any of these signs, all right, it's not that they fry on the mountain. It's not that your heart is bad, you need to do surgery, that you need to. No, it's a sign that whether your weight or your blood pressure or your blood sugar, one of these things is having an impact on your heart. All right, meaning you need to take action. So it's not that your heart is bad whenever you notice any of these things. And make no mistakes, all these signs I'm about to talk about, they are very clear things that happen. You won't be doubting it. You won't be saying, did I feel like that? Like I felt something like that. And you start imagining symptoms that are not your own. No, you will be clear. You will know for a fact that you've experienced this or you have not experienced it. Okay? So it's important that I put that out there so that nobody gets scared, nobody gets worried. Okay, so the first one I'm going to talk about is something called angina pectoris. All right, it's called angina pectoris. Let me create the other slide I wanted to create here. Yeah, 5 signs. And the first one, angina pectoris. So, my bad, I should have probably typed this out before starting this live stream. But it hits me really late that there are some things that you won't know if I don't type them out. So, that's angina pectoris. Now, what is angina pectoris? Angina pectoris is a gripping pain on the left side of your chest. Look at this picture. Look at this man, right? If you look at this man, all right, that is a gripping pain. Or it's a gripping pain on the left side of the chest. All right, that's angina pectoris, or most people just call it angina. All right. Now, what happens with angina is that there is a part of the heart that is not getting enough blood supply. Now, if you remember, we said that something that can block the heart is cholesterol. It can block blood vessels. Another thing that can make it difficult for blood to flow is diabetes, when the blood sugar is too high. And also another thing is high blood pressure. It can affect the flow of blood through the blood vessels. So whenever any of these things causes a problem to the supply of blood around the heart, that part of the heart will, quote unquote, cease function temporarily. All right. It will, of course, immediately the body will try and compromise to fix it. All right. But what happens is, for that period of time, you will feel a gripping pain. All right. So what has happened is that the blood supply to that part of the heart has been compromised for a while. Now, usually this gripping pain only lasts for a few minutes, maybe 1 to 3 minutes, and then you get relief. And most times you feel relief without doing anything. The pain just disappears on its own. Serious pain. As you can see, this man in the picture is in serious pain. All right, and he's holding the left side of his chest. It's usually very serious. Sometimes it can last up to 15 minutes, but the classic thing is that it often disappears on its own, and you cannot even point at anything that triggered it. It's not like maybe you were involved in an accident, you fell down, something hits you in the chest. You can't think of anything, but it will just grip you and go. And you will notice whether you lie down, whether you bend down, whether you are straight, whether you turn to the left, turn to the right, it does not change the pain. It does not trigger the pain, it does not relieve it. All right. So if you are considering whether you had one pain in your chest and you're thinking maybe it's related, these are some of the things that you keep in mind. For a lot of people that have chest pain, it's usually maybe because of the way they slept or something like that. And you will usually notice that when you change position a little bit, the pain seems to feel better. That's not angina. With angina, it strikes 1 to 3 minutes. If it's really bad, up to maybe 10 minutes or so, it disappears completely for maybe a week or more. All right. um there are drugs that you can take to manage this, but I will not prescribe a drug. Okay. I'm going to talk about the symptoms, and I'm going to tell you one or two things that you need to do, because it's not the kind of thing you just go and take drugs. It's not just, ordinary minor malaria that you can take drugs for and just move on with life. Okay. So that's the first one, angina. All right, a gripping pain on the left side of the chest. Gripping. It's not, you will know that something is hooking you. All right, and then it releases you. Now, in a number of cases, angina might come with chest tightness. All right, there is a gripping pain. For some people, they also have some chest tightness at that point in time. And generally, to add, if you often just have chest tightness that you cannot explain, all right, you cannot explain it, and you know you are trying to manage your weight or your blood pressure or your blood sugar, and you suddenly start having chest tightness that you cannot really explain, please, that's something that you need to take note of. All right, so that's the first one: angina plus or minus chest tightness. Okay, and this is the spelling of angina pectoris. Okay, so the next symptom that we're going to talk about is your vision. Your vision. Now, remember, we're talking about things that tell you that your heart is under pressure, either from your weight, your blood sugar, or your blood pressure. Signs that tell you about it. The next sign that we're talking about now is your vision. What are the symptoms I'm talking about? Unexplained blanking of vision. For no reason, you just, for maybe a few seconds, your sight just goes dim. For some people, for a few seconds, everywhere just gets blurry and then it clears up. For some people, for a few seconds, everywhere starts turning. And it's not that you've not eaten, that you've eaten. For some people, and I just hope that you're taking off. For some people, is that when they stand up, they feel lightheaded. All right? They stand up and they just feel lightheaded, or they stand up and then the vision goes dim and then it opens up again, or they stand up and then everywhere gets blurry and then it opens up again. What is important to note is that it's usually transient, a short period of time, and then it clears up. So I'm not talking about people who use glasses, maybe you don't see very well, your own is, for in that kind of situation you will know, because whenever you take off your glasses, everywhere is blurry. So that's different. This one I'm talking about is that for a few seconds or a minute, something happens with your vision and it's both eyes, all right, and then it clears up and it normalizes afterwards. It becomes perfectly normal afterwards. All right, now in this case, what is happening is either because of the effect of the blood pressure on the heart, the blood sugar on the heart, or the fat, the cholesterol in the body. What's happening is that the heart is not pumping blood well to your eyes. That is simply what is happening. In some cases, it's that the heart is not pumping blood well to the brain. All right, now when either of these happen, what it will result in is that shortage in blood supply will affect certain sensory organs, most commonly the eyes. All right, the blood supply to the brain is compromised, it's affecting the vision, and so because of that shortage, it's like the eyes were disconnected, from the I'll try and use something that anybody can relate to. Like current. Imagine the current just goes dim or the current goes low in your house. Your bulb will go down. That is exactly what is happening. So the current of blood flow from the heart, because of the effect of high blood pressure or blood sugar, whatever it is, because of the effect of that on the heart, the current from the heart can get dimmed from time to time, and that will affect vision. All right, so let me type it here. It's vision. um so vision, and this vision can be blurry, it can be dim, it can be light headedness. All right, so blurry vision, dim vision, those are the commonest one. Then you can also have lightheadedness, you can also have dizziness, and you would often notice, all right, you would often notice that it is triggered by standing up. For some people, it's triggered by sitting up. And let me make this as a very important point to note. Please, whenever you wake up in the morning, don't just stand up and jump on from the bed. Especially for people who wake up late and then you just see the time on your phone and then you jump out of the bed. Please, it is not healthy. Whether you have high blood pressure or not, generally speaking, it's not healthy. You're supposed to wake up, sit up first. All right, sit up first and then stand up from the bed. Again, you wake up, you sit up first on the bed before, and you stay for maybe 5-10 seconds before you stand up. All right, it gives your heart some time to adjust. However, for this one I'm talking about, whenever there is now a burden on the heart that has compromised the current of blood supply, all right, what will happen is that when you stand up, you will notice those symptoms. It's classic. You stand up, everywhere just starts spinning, and you have eaten that day. You stand up, everywhere just goes dim, and then it opens back up again. Please, it's a sign that there is some excess pressure on your heart, either due to blood pressure or blood sugar or um, fat, cholesterol. So, like I said, it's not that the world is coming to an end. It's not that your heart is bad or anything like that, but you just need to know what to do. And I'm going to tell you that once I'm done running through this. Okay, the next one I'm going to talk about is breathlessness. All right, breathlessness, and I'll slash that with easy. It's something we call easy fatigability. And for those who are online, I'm going to spell it out: easy fatigability. All right, you just notice you get tired easily. Now, it's important to note that this is not you comparing yourself to someone else. So please don't go out there and tell someone, you cannot even do this thing that I can do. Something is wrong with your heart. Please don't do that. All right. You are comparing your present with your past. And again, you cannot compare with when you were a very young child running up and down anyhow. No. You are comparing with maybe the past 2, 3, 4 years. All right. And this is what I'm talking about. Maybe you have a staircase at home that you just notice of recent, just climbing that staircase and you are panting, you are exhausted. And in fact, in some cases, people will tell you that, is it not just this small distance that you climb? What's the problem? Why are you panting like this? For some people, it's a small distance that they walk, all right, very short distance. And you know normally that this distance is not like it's one serious thing. So why am I so tired? For some people, is that they are always just tired. All right, that's what we call easy fatigability. You just get tired so easily doing activities that normally would not make you tired. All right, so there's that. Now it often comes with breathlessness because you see the person panting, trying to catch their breath, and you be wondering, did you just finish running a race? Why are you trying to catch your breath? All right, that is an important thing to note. For some other people, okay, they notice the symptom when they lie down flat. So for anyone who notices that whenever you just lie down flat, it is hard to breathe, you now have to put like maybe 3 or 4 pillows under your head for you to sleep. That is a very, very important sign to note. If you have to put 3, 4 pillows under your head, it's an important sign to note. All right. Um, so that's easy fatigability with breathlessness again, right? You get tired easily doing activities that normally would not make you tired, or you get breathless when you lie down flat, or you get breathless after doing minor activities that ordinarily shouldn't be stressful, all right, relative to how you know yourself. Again, if you are 90 years old, you cannot be comparing yourself with when you were 50 years old. If you are 50 years old, you cannot be comparing when you were 20 years old or 25 years old. So that's some context you need to keep in mind. So if you are comparing, always think about maybe last year, last 2 years, or last 3 years, or if you can categorically say that there was a particular day you woke up and this symptom started all of a sudden. Yes, those are things that would apply. Okay. The next one we're going to talk about is what we call paresthesias. All right, paresthesias. Now, paresthesias are abnormal sensations. Oh, and I did not explain the medical aspect of easy fatigability. So let me quickly explain that. Right, what happens is because the heart is under so much burden, either due to the blood pressure, the blood sugar, or the cholesterol level, because the heart is under so much burden, once you just do any little activity, the heart is already tired. All right, because of the extra burden that you should not be carrying, it easily gets tired, and that's why you easily feel tired for almost doing nothing. All right, so that is how it works. All right, that's the logic behind it. Paresthesias are abnormal sensations. For a lot of people, they might feel a tingling sensation in the hands, tingling sensation in the legs. Yorubas call it paja. For you to know what I'm talking about, you will notice if you've ever entered a bus that is very tight, or maybe you have to sit in one uncomfortable position for a long time, then you finish, you stand up, and then it's like you cannot feel your legs. You are stamping your leg on the ground. You are not feeling one kind of shocking sensation. That is an example of paresthesia. But not because of the heart, right? That one is because of your position. What just happened in that situation is that you disrupted blood supply because of the way you were sitting down. All right, so don't get it mixed up. However, for people who have the one that is related to the heart, it's not that they are sitting in any uncomfortable position. It's not related to whether they are sitting, they are standing, whether they are, it doesn't matter whether they are lying down. They just have abnormal sensations, and they might feel like there's something on the leg. When they look at the leg, there's nothing there. They might feel like there's something on the hand that is shocking them. For some people, it's numbness. You know, like I said, you get down from that bus and it's like you cannot feel your leg. It's numbness for some people, and in some cases it's transient, right? It disappears after a while and then comes back. In other cases it's just persistent. All right, it doesn't go anywhere. These are things we call paresthesias, and what happens is very similar to what happens when you are in a bus, right? Because of the position you took in that bus, the way you put your leg, you were disturbing the blood flow to your feet, right? Now, for the heart too, because of the burden on it placed by the blood pressure, the blood sugar, or the cholesterol level, because of that, again, the same current is not as it should be. More or less, like I want to just keep using this analogy, low current. So because of that, all right, the blood supply is now compromised to certain parts of the body. Again, like I keep saying, it's not the end of the world. There are drugs that you can take. That's all. But you need to know that it's something that you need to address. All right, don't just ignore it. You just regularly keep having paja regularly, and you don't know why. You keep having a falling sensation in your hand. You keep having some numbness in your legs. You don't know. For some people, it's so bad that, especially for diabetes, they can get injured. All right, and they won't know. They won't know. All right, they can get injured and they won't know that they've been injured because there is numbness, almost complete numbness. All right, they can't feel anything. So in diabetes it can get that bad, but for just issues around the heart, most of the time it's transient. It comes and then it disappears for a while. One that might be persistent is abnormal sensation. They just keep feeling like there's something on the leg or on the hand or something moving around their body. They can't really explain it. It could be as a result of the burden on the heart. So that's paresthesias. Okay, so that was the fourth one. The fifth, all right, the last and final one. Hold on, I want to be sure I'm not missing anything. Yes. Now the last and final one, which is more or less something that anybody can guess, is uncontrolled blood pressure. And for me, I need to be very specific about this. I'm talking about blood pressure that goes above 160 over 100. Blood pressure at or above 160 over 100. You ever check your blood pressure and it gets to that level, it is very, very, very unsafe for your heart at that point in time. All right, that blood pressure is very, very unsafe. The blood pressure must be controlled. Not only is that blood pressure a problem for the heart, that blood pressure puts almost every other organ in your body at risk. All right, it puts almost every other organ in your body at risk. So it's important for you to note this. And of course, When the pressure from cholesterol is high, the burden of the blood pressure itself, because like I've told you before, one of the risk factors for high blood pressure is high blood pressure. Okay, high blood pressure causes certain damages around your body, particularly the heart, that more or less creates a beautiful environment for other factors to come in that will now increase the blood pressure even higher. Okay, that's why whenever I have conversations with patients and we have this back and forth, they say, and the blood pressure is high because there was something that happened 2 weeks ago, and my landlord is disturbing me, and my children, house rent. It does not matter why the blood pressure is high, because as long as it is high, it is creating an environment to invite more factors that will push it higher, such that when you even finally pay that house rent, it does not matter anymore. Those factors have caused the damage, and the blood pressure will just remain high until you start treating it. So I must emphasize, it doesn't matter why the blood pressure is high. The bottom line is it must come down. That is it. The blood pressure must come down. 160 over 100 is a point where you need to start taking some steps to ensure that your heart is protected. Okay, now that I have mentioned this, so like let me just run through angina, which is a gripping pain on the left side of the chest, vision changes, blurry vision, dim vision. For some people, I forgot to mention loss of consciousness. It just faint completely, right? And they don't know why. Please, all right, lightheadedness, dizziness, those are under vision issues. Easy fatigability, you get tired easily. Paresthesia, abnormal sensations, all right, and then blood pressure above 160 over 100. If you have any of these, or if you know anyone who has any of these, it could be a sign that the person's heart is under undue pressure and they need to take action. What are the actions that you would need to take? Number one, I have to say you have to first of all see a doctor. All right. This one is just a formality, but you have to. Why do you need to see a doctor? So that you are not overthinking what is not a problem. All right. A doctor will take a better history from you and actually let you know whether it's something to worry about. In addition, a doctor will listen to your heartbeat. All right. So, let me type that down. So, see a doctor. Okay. Step number 2, you do what we call an ECG. All right, an electrocardiogram. All right. Okay. Yes, an electrocardiogram, an ECG. All right. And what an ECG does basically is that it reads your heartbeat. It reads all the electrical activity around your heart and it interprets that to tell if truly there's something happening with the heart. Now, an ECG procedure can seem a bit scary, but the truth is, it is a lot of quote unquote ceremony. They'll put one thing on your hand, put another thing on your hand, put another one on your 2 legs, and they'll put like 5 different things on your chest, and you feel like, oh my God, is this the end of the world? It is not that deep. It is just the way the machine is. It's not something to worry about. All they are trying to read is they want to read your electrical activity at the heart, but then relative to the whole of your body. That's why they are putting on your hand and everything. All right. They want to just read the heart activity, the electrical activity around the heart relative to the rest of your body. And what that will simply tell, like I said, is if there is any abnormality in the electrical activity, then they know what to do. In addition, there are certain drugs that are used to manage this kind of things. Again, I'm not going to make any prescription. They're in the classes of blood thinners. There are also the classes of nitrates. They all have their different ways in which they function to ensure that blood supply is fine. Like I said, I'm not going to say the particular name. These are just drug classes. Um, please don't go and take any drug by yourself, because some of these drugs actually put you at risk of having ulcer. So please, that's why I said discuss with your doctor. So your doctor will review your ECG, review your symptoms, and of course, it goes without saying, if you are feeling any of this and you have not checked your cholesterol level, you have not checked your blood sugar level, please go and check. That's an addition to the ECG. The main thing for starters is the ECG. Of course, there are other tests. There is an echocardiogram, but usually that's when you start seeing a consultant cardiologist. And again, an echocardiogram is just like a picture, all right? Like for pregnant women, right? They do ultrasound to look at the baby, right? So for people who are trying to look at the heart, what they do is an echocardiogram, all right? So it's like an ultrasound scan, but for the heart. So they will just put one small machine. They'll just be rubbing it on your chest. As they're rubbing it on your chest, it's connected to the monitor. They'll be seeing how your heart is beating and all that. Of course, it's expensive. It can be up to about 70,000, 60,000. So usually it's when you've seen a specialist, a consultant who thinks that you really need to do it. And it often would come after you have done an ECG. That's the electrocardiogram. So it's often after you've done that that you would now be thinking of an echo. But please, electrocardiogram, blood cholesterol, blood sugar, these are basic things that you need to start with and then have a conversation with your doctor. So these are the 5 symptoms. All right, these are the 5 symptoms that you need to keep in mind. If you know anybody who complains of a gripping chest pain that lasts for about 3 minutes and then it has gone, and the person has already quickly gone to give testimony in church, please tell the person, yes, we thank the Lord, but you need to get that checked, get it reviewed. And one thing I must note is that you need to take action fast, especially with angina, because in angina the problem is blood supply to the heart, and the heart is a very vital organ. What people feel during angina is very similar to what people feel during a cardiac arrest. All right, and a cardiac arrest, of course, is fatal. The difference between both of them is not exactly much. All right, what happens in angina is that you recover, but the truth is we don't know when that angina can turn into a cardiac arrest. All right, so it's important for you to take action as quickly as possible. Start your medication, protect your heart, and you should be good. That said, for people who are doing exercise, if you notice any of these while you're doing exercise, please slow down. All right, slow down if you notice any of this while doing exercises. And I think that is more or less everything I have on this particular conversation. Uh, do let me know if you have any questions. I think I'm just going to take questions right now. I've said a lot, so I'm just going to take questions from everyone right now. Any questions? Any questions? We've talked about angina, vision, transient changes in your vision, getting tired easily, abnormal sensations that you can't explain, and then blood pressure above 160/100. Those are the major symptoms that you need to keep in mind. And I've told you what to do. See your doctor, do an ECG, electrocardiogram, check your blood cholesterol and your blood sugar, because of course you need to control those things. A bonus point for people who are struggling with their weight: if you're struggling with your weight and you often have joint pain, especially in the knees, there's not much to worry about. It's most of the time it's just an effect of your weight on the joints. With those kind of people, you just take it easy on exercise and do more of diet. That's what I'll recommend till the weight is a bit better for your knees. To add to that, red meat is also another major cause of joint pain. So for anybody dealing with that, while being overweight, you might want to avoid red meat. So generally red meat is not very healthy. So there's that. Okay, so since there are no questions, I think we are good. Everybody is on the same page. Um, we can, so feel free to educate people around you, let them know what they need to do. And yeah, I hope this was impactful for someone. we're still trying to grow our YouTube channel, so please get people to subscribe as much as possible. That would be very much appreciated. And I think we can call it a day. I was still trying to wait to see if anyone has any question, whether related to what I just discussed or unrelated. Um, but since there is no question, thank you all so much for coming through. You can always still drop your questions on the group if you have any, and I will respond. Everybody have a great week. Take care of your heart, take care of yourself, and be good. Take care and goodbye.